Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director of Continuum Health Services. And we're very happy to have a special guest with us this week, Ed Dooling. He is the Chief Human Resources Officer for Masonicare. Welcome, Ed. Thanks for joining us today.
Good morning. Thanks for having me.
It's a pleasure to have you. We all talk about the ways in which the COVID-19 pandemic has changed many aspects of our lives, including how companies operate. What are some of the ways our organization's workforce has adjusted during this time?
Right. Yeah. So our workforce has had to change in many, many ways, from our clinical staff who have had to really fight through wearing, PPE that they've not been used to wearing in the past, donning and doffing that PPE, working with masks nonstop. It's really been it's been a challenge, and it's been tough, and they've fought through it and persevered. For our office staff, we've had a number of our corporate services employees who really, in the matter of a couple days, had to go from working in the office full time to working from home full time. So, our IT department had to make sure that was all set up. Our employees had to kind of learn a new way to work, and our managers had to learn a new way to manage. And so it's been very different these past 15 or 16 months. But it's really been a testament to our workforce and their ability to really change and adapt, persevere, and really we've really depended on them to carry us through this, and they've done a tremendous job.
Absolutely. Thank you so much. And JP, echoing Ed's message, it really just can't be said enough how grateful we are to all of our team members for their dedication and their compassion during this pandemic and always.
Sandy, our staff have been truly amazing. Ed hit it on the head in so many different ways, but our staff have really, as Ed said, persevered. They have really been through 14 to 16 months of very challenging times, whether it was with PPE, whether just dealing with the emotional stress of home and at work is really been a very difficult time, but they have done a fantastic job. Seeing some of the staff over the past few weeks, they're tired, but they're very excited about the aspects of us getting back to normal, and you could see that in their eyes. Can't see it through their mouth or their face with the mask, but through their eyes, they truly are looking to continue the good work that we do here at Masonicare. And Sandy, it's interesting because one of the things that I was thinking about before we had this presentation today is about 2 weeks ago, one of our leaders at the healthcare center said to both Ed and I in a meeting, I actually get to interview people face to face. And it dawned on me, that's been one of the biggest things that has been a challenge, is that we've been doing a lot of virtual interviews. So the Human Resource Department has done a truly amazing job at sourcing and doing the interviewing, but the managers that are doing the final interview, if you will, have had to do it virtually. And that's been a different dynamic that I will tell you, hearing some of the data, they've done a fantastic job at attracting new employees, being able to do those interviews, but nothing takes the place of actually having a face-to-face interview. And this particular leader at the healthcare center was just so excited that she was able to actually sit down with somebody and have the interview process. And that's been definitely something that has been different. But through all of this, the staff, and I can't say this enough, have just been truly an inspiration to all of us within Masonicare for everything that they have done. Talking to the residents, I was up at Asher Village last week, and just hearing some of the residents talk about how great the staff have been through this time, or down at the healthcare center, talking to one of our residents on one of our floors, talking about the staff being dedicated, being compassionate, being that ability to want to serve in whatever way, shape, or form they can, has been amazing. So my hat's off to all of our staff within our entire organization, because the stories I hear from family members, the stories I hear from staff have been extremely positive. And my final hat is off to Ed Dooling and his staff for continuing the retention and engagement of all of our staff and future staff. As we move forward, we're going to continue to battle with attracting new staff and retaining existing staff, and Ed and his staff have done a fantastic job, along with the leadership of Masonicare. So thank you, Ed. Thank all your staff, and thank all of our staff at Masonicare for everything that they do each and every day.
Wonderful. Thank you, JP. Dr. Schwartz, as we always do, we turn to some hot topic medical news and reports of a possible link between the COVID-19 vaccine and heart inflammation in children has many of us parents and grandparents also concerned. What have you been learning about this?
Well, Sandy, every week that we do these shows, now I think we're up to, even I kind of lost count. I think it's number 28 or 29, but we never are short of having a topic to talk about. And I'll talk about that in a minute. But again, I wanted to welcome Ed as well and share, all the praise that I can, along with JP. Ed and I have been colleagues and friends probably for more than 15 years. It's been great to work with you and everything you do, particularly with it's hard to believe now that things are getting better, what a crisis we really went through and are still recovering from. But again, I want to thank all the staff too, which I will do later, as I usually do at the end of my message. But I guess today we'll turn to the word of the week, which is myocarditis. So what is myocarditis? Well, just briefly, without giving a long lecture, the heart has different layers to it. It has an inner layer called an endocardium. It has a middle layer called the myocardium, and an outer layer called the pericardium. So some of you may have heard the terms endocarditis or pericarditis, and myocarditis is like this middle layer. Myocardium is a pretty large layer that kind of surrounds the muscle of the heart, and the heart is a muscle. So the itis part means that the muscle gets inflamed, and from myocarditis, the most common cause is a viral infection of some sort, a viral myocarditis. So once again, Sandy, I thank you because you helped me find this nice article that kind of gives some very good quotes from some specialists, both from Yale and Connecticut Children's Medical Center, regarding this issue of myocarditis in children and its relation to the if any, to the COVID vaccine. So I just want to read the title, which says, "Could the COVID vaccine cause inflammation of hearts in children? CDC investigating as over a dozen hospitalized in Connecticut." So what this says is the CDC is investigating to see if some of these cases of myocarditis could be connected to the COVID vaccine. So there's the Connecticut Commissioner of Public Health, and her name is Dr. Deidre Gifford. And so this article is from about a week ago, but what she said is, so far, 18 kids in Connecticut have been hospitalized. 17 have since been sent home from the hospital, and one remains under observation as doctors try to see if this is linked to the COVID vaccine. And the reason they say that is that adolescents who would receive the vaccine start to get some symptoms. And what are the symptoms of myocarditis? So basically, you could get chest pain, you can get shortness of breath, maybe fever. Sometimes it mimics almost like having a heart attack. And I guess some clinicians had noticed there were a few cases of adolescents that had these symptoms maybe a week or two after getting the COVID vaccine, and they were trying to see if there was any connection to it. So as Dr. Gifford further says, we've been in touch with the CDC to make sure they are aware of the cases, so they're studying this question. And I guess as you mentioned in my introduction, the big question for parents is, should you continue to get your child vaccinated? So this is where I give the opinions of two experts. One is Jeremy Asness. He's the chief of Yale New Haven Children's Heart Center. Sounds like a pretty big authority. And he says, yes, you should absolutely continue on with the recommended vaccination schedule. The myocarditis that we are seeing thus far is very mild. Another Dr. Salazar, who's from Connecticut Children's, says, if it happens, it's rare. Is it associated with a vaccine? Maybe. We don't know yet. And when it is seen with a vaccine, the cases have required hospitalization, but they have recovered fully, which is good news. So I think this is the final and the real take-home point that all these doctors are trying to make. So both Yale New Haven Children's and Connecticut Children's recommend getting vaccinated, because when you weigh COVID versus myocarditis, children are recovering from the inflammation of the heart, but have died from COVID. So far, none of the children have suffered any long-term effects from the vaccine. So I think that's very important to be aware of and to continue to follow. And now the moment, hopefully you're all waiting for, my inspirational quote of the week. Healing doesn't mean the damage never existed. It means the damage no longer controls our lives. And this actually came from the same inspirationalist as I found last week. I guess he had a lot of important things to say, Brian Mateo. But you see, we are healing. But it takes a long time to heal in anything that happens. And this pandemic really took a lot out of all of us. But we just got to continue to work together and continue to work as a team, and we'll continue to get through things. So again, my final message, as I say, is I thank everybody for their hard work and dedication and perseverance. And again, I wish you health and I wish you peace. Thank you.
Thank you so much, Dr. Schwartz, for sending us on our way as always. And we do wish everyone a week ahead of healing. I want to thank you all for sharing your time and your insights with us today. And of course, we thank you once again for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.